Hey, this is Journey to Competence. I am Jillian Dean. It is January 18th, 2026, and this is for the internship class Counseling 6983 with Dr. Jennifer Van Pelt. So let's get started. So our introduction is a little lengthy, but it goes over the internship experience. So on Tuesdays, I would travel to McLeod, and that was about 2.5 hours away. And typically I would get to the agency about 7:45 or 8, and then I would stay until about 7 p.m. every Tuesday. Now, those were very long days. However, I do think that that experience was well worth the miles through the wisdom, the care, and the encouragement from my supervisor. Throughout this season, my site supervisor really truly challenged me. She gave me opportunities, giving up her Tuesday so that I could have the same clients week in and week out, practicing these theories and these techniques. Miss Marshall encouraged me to have confidence in coming alongside of these clients and have empathy. But someone else was very integral in this process, and that is my husband. He is the one who challenged me to go back to school. He is the one who has been the biggest support system throughout the internship experiencing, just making sure everything is taken care of and I am supported as I transition careers here in the not so distant future. So our learning objectives covers the clinical skills that are desired and the training that I wanted to have more experience in, such as like treatment plans, individualized interventions, and safety planning. A lot of the clinical skills desired were reflection and summarization and open-ended questions. And this desire in ethics and professional identity is to gain experience in establishing these healthy boundaries and being more comfortable with the process of like intakes and boundaries and documenting each session. The hope was to feel more comfortable and present. So in the experiences portion, there was some client interactions and some definitely challenge and lessons learned. And we're going to dive into that in a few sessions, but I truly believe that these challenges, the interactions between the clients, that experience is the best teacher when developing counseling skills. Through the internship experience, I desired to have professional modeling and skills where I was the weakest. So that would be reflection, summarization, and open-ended questions were areas that I need to focus on in growth. Treatment plans are something that I also didn't know how to implement like structurally in a clinical setting, as well as intervention and safety planning. So multicultural competence is something that I did desire to grow in as well. I grew up in a multicultural demographic. So when I moved to Oklahoma, that was the first place I lived where, as a white female, I was a majority. So during my internship, since I was a little bit away from my normal area, I was able to be in a more diverse situation, like in a clinic, and then just exposure to those clients. While this did challenge me in more ways than I thought, I was able to gain like more sources and also experience ways to advocate for all cultures and combat any systemic stereotypes or barriers. So we're going to talk about two different experiences that I had during my internship. The first one was a white female. She was 56 years old, and she presented criteria for PTSD. And she desired to work through that trauma. She wanted to kind of lessen her panic attacks and some irregular heart rhythms she was experiencing. this was such a humbling opportunity to work alongside my supervisor as I did the counseling side of things with a focus on dialectical behavioral therapy, while she did EMDR as well as neurofeedback and with my supervisor. And so in conjunction with these, over the course of 6 months, we saw significant growth from this client. Her panic attacks had lessened. She had gotten off like one of her medications for some of her heart issues. She felt like she's been sleeping better. She was able to have more energy to work out. She also talked about how she was able to just be more present in her day-to-day life. Like her train of thought didn't go off the rails, as she would say. Multiple times throughout the day, she was able to focus and be in conversation with people. Although we know with like the highs of something like that, there is also the lows. And so I and 2 other clinicians in the practice were working with a set of brothers who had been adopted by their foster mom. It was 3 boys, and they were stair-step kids. And so I had an African-American male, and he was 8 years old. So when he came to the clinic, initially, we went through the informed consent, we went through treatment planning, we went through all of the paperwork that we needed to do to get him set up. So as treatment began, he had a former diagnosis of ODD from a former counselor. But when he was coming to see me, he truly presented more criteria for reactive attachment disorder. The diagnosis wasn't super important at the time. The treatment plan was, and we were trying to work through some of the treatment plans and goals so that we could kind of focus on what we needed to do with this young man. During sessions, we were having quite some time with the mom because she insisted she sit in sessions, and we told her that was fine, but she didn't need to impede the counseling experience. And my supervisor did do that. I did not. But the mother would continue to answer for him in session. And it got to the point where she would not allow him to answer, and she would answer. So over time, attempts of having a conversation of, hey, we really need him to answer. We really need him to respond so that we can kind of help him work through some of these explosive anger outbursts and violent eruptions. And she did not. We reminded her about the agreement she signed, about not impeding the counseling process, but she rebutted, and she did not want him answering for himself, and then continued to make excuses for his violent eruptions. This was challenging. We were able to work through some things and create a system, and over time, my supervisor really showed me like how to handle this lovingly with the client, as well as advocate for the client's growth. And so for both parties, the mom and the son, she was able to advocate for both of them and say, hey, we're here to help you and come alongside you as much as him. We want to see like you happy and healthy and not being, worried about, behavior, or not worried about what he's going to say at school. We want to help you work through some of these, and also encouraging her to maybe go get some help if she was feeling like she needed that. So it was a great learning experience for me, being so green and new, and also to see how my supervisor supported me in that situation as well. So next, we're going to look at supervision and mentorship. In the clinic at the Ivy Center, the client's welfare was always the priority in the clinic, and ensuring that the treatment plan and their goals were being communicated before and after the session. So as seen in the snapshot on the bottom of the slide, my supervisor challenged me in loving and effective ways. She desired not just growth for the clients, but always striving towards growth in counseling abilities in interpersonal areas, helping me feel more confident towards graduation. So, and looking at development in this slide, there was a lot of challenges and hardship to get here, but I really feel like the depth and the efficiency in these counseling skills were enhanced and better understood throughout the internship experience as a whole. I did find that like the summarizing, the open-ended questions, and the concluding sessions on time, that was super effective in increasing like emotional effectiveness and like furthering personal like exploration. So in a previous slide, you saw me talk about some challenges I faced with clients. And just like the African American 8-year-old male, there was some challenges there, but there was also some growth too. There was also some challenges with the commute. It would be challenging at times driving both ways in one day, as long as a long caseload. But I was really, truly so grateful for the opportunity and have a routine with the same clients. Being able to work with them and truly just give them some consistency too. Neurofeedback is also something that was pretty challenging to learn, and I had to work to understand where each client was placed and to double check and make sure we didn't need to move them, to make sure that everything was in its proper setting so they would get the most out of the treatment. But on the flip side, there was also growth in neurofeedback. Never done anything like that before or experienced it, so that was pretty awesome. Growing in endurance, just doing hard things and pushing yourself to a limit, that felt so good to achieve and accomplish that. The caseload, I would have, multiple clients back to back to back. And so while the growth felt slow in the process, it was truly like an immersive experience. And I was so nervous about taking on the caseload, and I did not feel confident at all at first. But through like that, just again, immersive experience, I got to help people like veterans and adolescents and people who had trauma that I may have not gotten the opportunity at another site. And so for that, I'm just very, very thankful for my supervisor for helping me grow and build confidence in the mental health profession. And then also just being able to have exposure to the multicultural like diversity of the clients, socioeconomic classes, cultures, race, everything. It was just a wonderful experience that I was able to kind of work through and see and highlight if there's any like areas of bias, but also like implementing resources that were culturally appropriate, and just constantly having those checks of like, am I doing everything ethically sound and across the board, and I'm not just copying and pasting for each client. So that was definitely a challenge, but also an area for growth for me. I talked about this a little bit earlier, but the cultural diversity and just having the self-awareness and the assessment and diagnosis. This was really important to me. I strive to ask more open-ended questions and really, really work on my active listening skills. Outside of sessions, I prioritize my own self-awareness to ensure like if there's any bias I held, it could be worked on personally, and just like thinking about the tone, the timing, how I said things, and just really making sure that every single client was building, regardless of who they were or what walk of life they were from, a grounded like rapport. And that way, when that rapport was established, the goal of acting listening also became a priority, just to ensure that every person felt seen and heard in that clinical setting. So integration for theoretical approaches. So cognitive behavioral therapy was mainly used with adolescents through play therapy and games and emotion-centered sessions for anxiety. Dialectical behavior therapy was used with a few female clients in conjunction with EMDR for diagnosis of PTSD and tracking with the diary cards. And then IFS, or internal family systems, was used for adolescents with like trauma, foster children, and young adults. Okay, so the next slide would be self-care. So self-care, it looks a lot different for everyone. Self-care cannot undo exhaustion or heal bouts of stress. Rather, self-care is a discipline that should be scheduled and put in practice to promote healthy rhythms. Self-care can be viewed in the ways of rest, a hobby, social gatherings, personal projects, or even like maintaining hygiene routines. While the culture has focused on self-care, this concept is not new. While it is often taken out of context and framed in a selfish mindset, biblically, Sabbath was a command from God. Sabbath is discussed around 172 times in the Bible. The Sabbath is not meant to be a day where you do not do nothing, but the idea is to break away from the mundane day-to-day tasks and shift our focus from inward to the Creator and how He has blessed us. So in seminary, I was taught that like Sabbath is an opposite approach, and this can also be helpful. So obviously, I would not put my religious beliefs onto my client. However, this is some theoretical framework. For instance, so if you work with large groups of people, day in and day out, the Sabbath would ask you to maybe spend a day more in isolation or solitude. So you're reframing things, right? You're changing things up. And we can do that with clients. We can say, what would be the opposite? Or what would look like your ideal day for rest? And so Sabbath is something that is so vital to me. It is the reset button on my week. Every Friday night, my family and I have our Shabbat dinner. And if everything else that week falls apart, it is something that we can all cling to. We know it's coming. We know that we have scheduled it in. We have made time for it because it is important. We have prioritized it. That dinner kicks off like a time where we rest, we plan something fun, we go on an adventure. It's just something different. It's something, a way for us to either spend time together, but ultimately it's just a set time for us to be and to focus on our Creator. This has been vital, especially in this graduate school season, but I have found that when I schedule in this time of rest, I'm far more productive. I look forward to my time of rest, but then I look forward to my time of being productive and serving the Lord in various capabilities. On my desk at work, there is a Caravaggio postcard that I picked up in Rome, and it is a painting that I have loved since high school. It serves as a reminder to never stop growing, never stop learning. And I aspire to grow continually in all areas of my life. While I would not impose or have these expectations for my clients, like spiritually, I personally challenged myself the last 4 years to read the Bible chronologically. This has been challenging at times, especially with going to school, working full-time, and having 3 kids. But it has kept me disciplined, and it also focuses me on what matters in life. understanding scripture for the past 2 decades has been the marrow of my bones, and it pushes me to excellence every single day. Again, I would not push this on my clients. However, I do know that having this foundation, this spiritual foundation, pushes me to excellence. It pushes me to strive to do more, to help others, to love others, to hold space, to have empathy for others. Isaiah 61 talks about that, and that is the basis of my calling in mental health. And I am hopeful that through the years, the mindset each year would to have growth in the areas of concentration of neurofeedback, EMDR, trauma, adolescents, and families, and even anxiety, understanding that more and helping people walk through and navigate that better. While I will do my best to ensure my interpersonal skills are taken care of, ultimately I know it's a privilege to walk with clients, and while I cannot do the healing, it is up to the client. They have to desire growth and development, and hopefully a little bit of my desire to do that in myself is a little bit contagious for them as well. So something to consider if you are considering an internship. This is something that after the fact I thought about, and it could be helpful for you, is one, do not be fearful or scared of being corrected. Imposter syndrome can feel all too real in this season. And to all the future interns, don't fear asking too many questions. Don't fear failure. Failure means you're trying. Failure means you're doing something. Failure means that you're working towards something. Don't be too prideful or to take criticism or correction. This is a wonderful safety net for us as future mental health clinicians. It is kind of a way for us to get our feet wet without being pushed out there entirely on our own before licensure. The supervisor is there to help you and work with you become a successful mental health clinician. They do not want you to fail. Before accepting an internship, make sure your ethics align with the counselor or the clinic and their practice. Even look into the theoretical applications, foundations that they're using, so that when you move towards your licensure, you have not only just experiencing, but you have an understanding of where you want to head and how you want to help others in your practice. Establish a time for indirect hours. This is something that in the very beginning, my supervisor and I made happen, and it was so helpful to me because a lot of my caseload was back to back to back, and we had to squeeze in supervision time while I was there. By us doing that, it gave me the ability to ask questions in a fresh way, because it was right then and right there. Other times, if I didn't have time to, I would make notes and write it down for the next time. And so we were able to, work through treatment plans and really work through the casework. Also, another thing is to ask the supervisor what their expectations are. While you may sign a contract, sometimes a verbal understanding of what you need to do on a day-to-day basis is also necessary. And just remember that you have healthy boundaries with your supervisor. You're going to be working in close proximity to one another for an extended amount of time, and so you want to have a good, strong foundation. I'd just like to say thank you so much for your undivided attention to this presentation. And if you have any questions or you need clarity on this, please don't hesitate to reach out. On the following 2 slides, there are references that I used in conjunction with this presentation, and they might be some helpful resources for you. So I hope that you have an excellent day.